Colon cancer, often referred to as the silent killer, is a formidable opponent in the world of health. It sneaks up on its victims, often without warning, until it has reached a stage where treatment becomes much more challenging. This type of cancer, which originates in the large intestine, has claimed the lives of many. Yet the key to defeating it lies in early detection. The earlier we can spot the signs, the greater our chances of survival. But how do we recognize the early signs of colon cancer when they are often subtle and easily mistaken for other less serious conditions? Each year, over 100,000 new cases of colon cancer are diagnosed in the United States alone. It's a staggering number, and what's more alarming is that colon cancer is the third most common cancer in both men and women. Unfortunately, nearly 50,000 lives are lost to this disease annually. But here's the good news. Colon cancer is one of the most treatable cancers when caught early. With timely intervention, the chances of survival are significantly improved. This script will delve into the critical early warning signs of colon cancer, signs that you should never ignore. We will also explore the importance of screening, lifestyle choices, and genetic factors in preventing this deadly disease. One of the earliest and most telling signs of colon cancer is a change in bowel habits. Your colon plays a crucial role in the digestive system, and its health is often reflected in how regularly and comfortably you can have a bowel movement. A healthy colon typically results in soft, brown stools that are easy to pass, with no blood present. However, if you notice any changes in your bowel habits, whether it's an increase in frequency, a change in stool consistency, or difficulty in passing stools, this could be an indication of something more serious. Bowel habits can be affected by many factors, such as diet, stress, or temporary illness. But when these changes persist for an extended period, it's time to pay attention. According to a study published in the Journal of Clinical Gastroenterology in 2012, changes in bowel habits, particularly when combined with other symptoms like blood in the stool or abdominal pain, can be an early warning sign of colorectal cancer. If your bowel movements become more frequent, or you experience constipation or diarrhea without any obvious cause, it is essential to consult with your healthcare provider. Diarrhea, for instance, can be more than just a temporary inconvenience. Diarrhea is medically defined as the passage of 3 or more loose or unformed stools in a 24-hour period. While it is a common symptom of various conditions, from food intolerances to viral infections, it can also signal a problem in your colon. The National Cancer Institute reports that diarrhea can be a symptom of colon cancer, particularly when the tumor disrupts the normal function of the bowel. In such cases, the cancerous growth may cause the colon to produce excess mucus or fluid, leading to diarrhea. It's important to remember that while diarrhea is often associated with less severe conditions, persistent or unexplained diarrhea should not be dismissed lightly, especially if it is accompanied by other symptoms like blood in the stool or unexplained weight loss. On the other end of the spectrum is constipation, another potential warning sign of colon cancer. Constipation occurs when bowel movements become infrequent or difficult to pass, leading to hard, dry stools. The colon is responsible not only for eliminating waste, but also for absorbing water and nutrients from the food we eat. When the colon's function is impaired, it can result in constipation. According to research published in the American Journal of Gastroenterology in 2010, over 80% of patients diagnosed with colon cancer had experienced constipation before their diagnosis. This symptom, though common, should not be overlooked, particularly if it is persistent and does not respond to typical remedies like dietary changes or increased physical activity. If you find yourself struggling with constipation that lasts for more than a few days, it's crucial to seek medical advice, especially if you notice other symptoms such as abdominal pain or blood in your stool. Blood in the stool is perhaps one of the most alarming signs of colon cancer, and it should never be ignored. The colon is responsible for storing stool before it is eliminated from the body, and when there is a tumor present, it can cause bleeding. This bleeding may result in blood appearing in your stool, which can range in color from bright red to dark, almost black, depending on where the bleeding is occurring in the colon. While blood in the stool can be caused by a variety of conditions, such as hemorrhoids, anal fissures, or inflammatory bowel disease, it is also a significant red flag for colon cancer. Early detection is critical. The Journal of the American Medical Association published a study in 2011 showing that individuals who sought medical attention for blood in their stool had a significantly higher chance of early diagnosis and successful treatment of colon cancer. In addition to blood in the stool, rectal bleeding is another symptom that warrants immediate attention. The rectum is the last part of your large intestine, and it is where waste leaves your body. Bleeding from the rectum can be caused by a number of conditions, including hemorrhoids, anal fissures, and even certain infections. But it can also be a sign of a more serious issue, such as colon cancer. If you experience rectal bleeding, it's essential to see a healthcare provider to determine the cause. Even if the bleeding is light or seems to come and go, it should not be ignored, especially if it is accompanied by other symptoms like changes in bowel habits or abdominal pain. Unexplained bloating or abdominal pain is another potential early sign of colon cancer. Bloating can be caused by a variety of factors, from eating certain foods to having a slower digestive process. But when it persists or is accompanied by pain, it could be a sign that something is wrong with your colon. Colon cancer can cause blockages in the bowel, leading to a buildup of gas and bloating. According to a study published in Gastroenterology Research and Practice in 2013, patients with colon cancer often report bloating and abdominal pain as some of their earliest symptoms. The pain may be mild at first, making it easy to dismiss, but if it becomes persistent or severe, it should not be ignored. This discomfort could be a sign that the cancer has progressed, so it's crucial to seek medical attention if you experience these symptoms. Feeling constantly tired, despite getting adequate sleep, is another symptom that could be linked to colon cancer. Fatigue is a common issue that many people experience, often due to stress, lack of sleep, or other lifestyle factors. However, when fatigue becomes chronic and doesn't improve with rest, it may indicate a more serious underlying condition. Colon cancer can cause fatigue by several mechanisms, including blood loss from the tumor, which can lead to anemia, or the cancer itself consuming more of your body's energy. A study in the Journal of Clinical Oncology from 2014 found that fatigue is a prevalent symptom among cancer patients, often appearing before other, more obvious symptoms. If you find yourself feeling unusually tired for an extended period, especially if this is accompanied by other symptoms like weight loss or changes in bowel habits, it's essential to discuss this with your doctor. Sudden unexplained weight loss is another symptom that should raise concerns. While weight loss can be a welcome change for those actively trying to shed pounds, losing weight without trying, particularly if it's a significant amount, can be a warning sign. Of colon cancer. When cancer is present in the colon, it can alter the body's metabolism, leading to weight loss even if you are eating normally. Additionally, cancer can cause a loss of appetite, which further contributes to weight loss. The New England Journal of Medicine published research in 2015 showing that unexplained weight loss was one of the most common symptoms reported by patients diagnosed with colon cancer. If you notice that you are losing weight without changing your diet or exercise routine, it's important to consult with a healthcare provider to rule out serious conditions like cancer. Another subtle but concerning symptom of colon cancer is the feeling of being full all the time, even when you haven't eaten much. This sensation can occur when a tumor in the colon causes a blockage or slows down the digestive process, leading to a feeling of fullness or bloating. According to research published in Digestive Diseases and Sciences in 2012, this symptom is often overlooked because it can be easily attributed to eating habits or stress. However, if you consistently feel full after eating only a small amount of food, or if this sensation is accompanied by other symptoms like bloating, changes in bowel habits, or weight loss, it could be an indication that something more serious is going on. Prevention is always better than cure, and when it comes to colon cancer, there are several steps you can take to reduce your risk. Diet plays a significant role in colon health, and making healthy choices can help lower your risk of developing colon cancer. A diet rich in fruits, vegetables, whole grains, and lean proteins while limiting red and processed meats has been shown to be beneficial. Studies have found that high fiber intake, particularly from fruits and vegetables, is associated with a lower risk of colon cancer. Additionally, maintaining a healthy weight, avoiding excessive alcohol consumption, and not smoking can further reduce your risk. Exercise is another crucial factor in preventing colon cancer. Regular physical activity helps to keep the digestive system moving and reduces inflammation, both of which are important for maintaining colon health. The American Journal of Epidemiology published a study in 2011 that found individuals who engaged in regular physical activity had a significantly lower risk of developing colon cancer compared to those who were sedentary. While lifestyle choices play a significant role in reducing the risk of colon cancer, genetics also play a part. If you have a family history of colon cancer, particularly if a first-degree relative such as a parent, sibling, or child was diagnosed before the age of 55, your risk of developing colon cancer is higher. Genetic factors can. In the fight against colon cancer, knowledge and vigilance are our most powerful tools. Understanding the early signs and symptoms of this disease is crucial for early detection, which can dramatically improve survival rates. It's important to remember that changes in bowel habits, the presence of blood in the stool, unexplained weight loss, and persistent abdominal discomfort are not symptoms to ignore. If you notice any of these signs, it's essential to consult a healthcare provider promptly. Take proactive steps to safeguard your health. Schedule regular screenings, especially if you're over the age of 45 or have risk factors such as a family history of colon cancer. Colonoscopies can save lives by detecting precancerous polyps before they develop into cancer. Adopt a healthy lifestyle. Engage in regular physical activity, maintain a balanced diet rich in fruits, vegetables, and fibers, and minimize your intake of red and processed meats. Additionally, avoid smoking and limit alcohol consumption. Stay informed. Educate yourself about the symptoms and risk factors of colon cancer. Awareness is the first step towards prevention. Discuss your family history. If you have a family history of colon cancer, discuss it with your doctor to potentially start earlier screening and take other preventive measures. Remember, your health is in your hands, and taking these proactive steps can lead to early detection and better outcomes. Subscribe to our channel for more health tips and updates, and share this video to spread awareness about the importance of recognizing the signs of colon cancer. Together, we can make a difference in the battle against this silent killer. Thank you for watching, and always prioritize your wellness. Your life may depend on it.